We are broadly interested in clinical outcomes in patients with ankylosing spondylitis. And of course, a major outcome for many chronic diseases is the risk of hematologic malignancies. My name is Michael Ward. I'm an investigator at the National Institutes of Health, and I'm presenting along with my co-author, who is Dr. Sarah Al-Hashemi, who is also at NIH. I want to thank the journal for allowing us to present to you our article, which will be forthcoming in the January 2023 issue of Mayo Clinic Proceedings, entitled Risk of Hematologic Malignancies in Elderly Patients with Ankylosing Spondylitis, a Cohort Study and Systematic Review. We know these malignancies are elevated. The risk of these malignancies is elevated in patients with autoimmune chronic inflammatory diseases. And so we were very interested to study whether a non-autoimmune chronic inflammatory disease, such as ankylosing spondylitis, might also have elevated risks of hematologic malignancies. And this is clinically pertinent because there have been lingering concerns about whether certain therapies used to treat ankylosing spondylitis, particularly tumor necrosis factor inhibitors, might predispose patients to an increased risk of hematologic malignancies. So we began this study in the context of Medicare claims. So this was a retrospective cohort study of patients who were receiving Medicare between 1999 and 2015. We identified incident patients in that group who had ankylosing spondylitis and compared their risks of hematologic malignancies over that time period to a control group that had neither ankylosing spondylitis or inflammatory bowel disease. The cohort of ankylosing spondylitis patients included approximately 12,500 patients, while the control group of unaffected persons totaled almost 11 million. And the mean follow-up in both groups approached approximately 10 years. The main results of our study was finding an increased risk of non-Hodgkin lymphoma, chronic lymphocytic leukemia, and multiple myeloma among patients with ankylosing spondylitis compared to the controls, with standardized incidence ratios ranging from 1.39 to 1.52. So approximately 40 to 50% increased risk of those three malignancies in patients with ankylosing spondylitis. We did not find elevated risks of acute myeloid leukemia or chronic myeloid leukemia. We think these are important results for two reasons. First, it tells us that clinicians who are caring for elderly patients with ankylosing spondylitis should be at least have on their mind the possibility that these patients may develop one of these hematologic malignancies at increased frequency. We don't, however, at this point have enough data to recommend screening, for example, for multiple myeloma with serum protein electrophoresis, for example, because we have only detected this association and haven't really studied the cost and effectiveness of screening for this particular complication. It's also important because it alerts the clinician to think that should a patient with ankylosing spondylitis develop one of these malignancies, that it may not be necessarily attributable to any current or past use of immunosuppressive medication, but may in fact be related to the underlying disease. There are some limitations to this study that it's important to note. The study was based on administrative claims, and there's always the possibility of miscoding. We don't have data on the degree of inflammation or inflammatory activity of these patients to know whether the risk of hematologic malignancies was primarily among patients who had a great deal of inflammatory signs or symptoms as compared to patients who had less marked inflammation over time. And because we studied only patients 65 years or older, we don't know how these risks might translate to younger patients. Although I would say that as part of our study, we did perform a systematic literature review, which focused primarily on younger and middle-aged patients. These prior studies had found very little evidence of increased risk. So we think one of the reasons explaining this difference is that our study focused primarily on elderly patients who is the subgroup at greatest risk for hematologic malignancies. I invite you to read the article to look for additional details regarding the study that may help you in your clinical practice.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.